My name is Michelle Thompson. I am the Director of Marketing Communications for the College of Health and Human Services, and we want to welcome you today for how to weighing safely reopening Northern Virginia, our second in our series of COVID-19 webinars. And with that, I will turn it over to Dean Jermaine Lewis, who will be moderating our session today.
Thank you, Michelle, and welcome everybody. Thank you for participating today in the college's webinar series. So wow, I don't think we could have picked a better day for hosting this webinar for a couple of reasons. First, today, if you've read the paper, the U.S. hit 100,000 COVID-related deaths today, which was a milestone we were hoping to avoid. And number two, for those of you who reside in Northern Virginia, tomorrow we enter phase 1 of reopening Northern Virginia. So since May 20th, all states in the U.S. have begun to reopen communities. And this is a very delicate process with lots of factors to consider, including the weighing of best public health science and practices with economic and a host of other considerations. This is a very complicated decision-making process. While we've been staying at home or practicing safer at home to minimize and prevent exposures, there are increasingly reports about other unintended consequences of such practices. For example, we're hearing about reports of fewer prenatal, well child, preventive, chronic disease management visits amongst healthcare providers. There's concern that a larger all-cause mortality that we're seeing in the U.S. as well as in several European countries may reflect deaths from other causes other than COVID as a result of individuals not seeking the care they need out of fear. If you read or saw the news yesterday, the U.S. Census has estimated that 1/3 of Americans are reporting experiencing anxiety or depression during the pandemic, and that's the figure for Virginia is 31% of residents in Virginia reporting anxiety and depression during the COVID epidemic. Many localities are experiencing record unemployment and just a multitude of implications associated with staying at home. While most communities do have emergency preparedness plans, many do not have an adequate public health infrastructure in which to support those plans or implement practices. So, trying to advance the first slide. Is it showing? Yes. So I wanted to say a couple things about the COVID-19 pandemic. And for many of us, experiencing a pandemic is the first of a lifetime type of opportunity. We all know and appreciate that COVID-19 is a new respiratory-borne infectious agent that found a global susceptible human population with at-risk population subgroups, such as the elderly or individuals with other chronic diseases. In the context of no treatment, prevention becomes paramount until we can develop and make available a vaccine. So we've all been practicing social distancing, good hygiene, testing, quarantine practices. These are some of the many behavioral changes that are needed to keep the public safe. And these practices have been implemented throughout the U.S. in many states and localities. No one knows for sure if COVID-19 will reach pandemic proportions next year. And so when we're talking about reopening now, keep in mind that some of the same decision-making and contacts could pertain to next year as well, should the virus cycle back. So moving to the next slide. Just a few words about the Virginia landscape to personalize it, to bring it home. Since the first cases in early March through yesterday, we have over 39,000 confirmed cases, over 1,200 deaths. And in Fairfax County, where George Mason is located, we have over 9,800 cases and 340 deaths. The goals for Virginia in the next few weeks are to test 10,000 people daily, to ensure we have sufficient PPE, and to hire and train 1,300 contact tracers. So the big question is, as we move forward, will people continue to practice physical distancing? Will they seek testing as it becomes more readily available? And will they self-quarantine if necessary? And I just want to remind everybody that right now, our Washington greater region has one of the highest COVID-19 infection rates in the country. And we're all working to flatten this curve as quickly as possible. So just a few words about today's webinar. I'm really delighted to have a distinguished group of panelists who will bring different lenses and perspectives to this important topic of reopening Virginia. Each speaker is going to give you an introduction about his or her work and experience with coronavirus, so you have a feel for the areas they work in. And I will, as the moderator, ask the initial question to sort of kick off the discussion, and we are going to try to accommodate as many questions from the audience as possible. So if you're in the audience and you have a question, we need to go to the next slide. Please be sure to submit your question to the host, Michelle Thompson, who introduced this webinar, and we will try to have the panel address as many questions as possible. So, let's see if I can read that screen. I'd like to introduce our panel right now, beginning with Victor Hoskins, who's the president and CEO of the Fairfax Economic Development Authority. He is joined by Emmanuel, or Chip, Petroc, who's the co-director of the Center for Applied Proteomics and Molecular Medicine in the College of Science at George Mason University. We're also joined by Sean O'Connor, who's a professor of law and executive director of the Center for the Protection of Intellectual Property at the Scalia Law School at Mason. Also, we have Dan Hauser, chairman of the Department of Economics in the College of Humanities and Social Sciences at George Mason University. And lastly, we have Amira Roas, who's a professor of global health and epidemiology in the College of Health and Human Services at Mason. And I am Jermaine Lewis, the moderator of today's session. So, kicking off the first question for the panel, what do you see as the key indicators that we are ready to reopen Virginia?
Thank you, Dean Lewis. I've been working a bit on trying to really track the epidemiology of COVID-19, and I've been asked by businesses and other entities on what's the best way to reopen, and it's really critical that we monitor the number of cases as we move forward, and that includes the numbers of hospitalizations and deaths, which is one of the key metrics that was used to allow Virginia to make the decision to go ahead and enter phase 1. And so those hospitalizations are really critical to monitor because, again, the whole point of flattening the curve was to make sure that we had enough hospital beds and enough resources to adequately respond to the outbreak. And that's going to continue to be a really important indicator to track, along with the number of tests that are coming back positive and the number of deaths in this instance. The other thing we're going to want to track is the resources available, number of PPE, number of test kits, the number of contact tracers. You mentioned that Virginia is looking to hire about 1,300 contact tracers in the next few weeks. Well, earlier this week, we were at about 300. And so there are clearly there's a lot to do to improve our preparedness and response protocols in this area, and that's going to be very important to monitor and to make sure that we have those adequate people in place.
So Amira, I just realized that we were going to have each panelist introduce him or herself a little bit. So I'm wondering if, Michelle, if you could go back to our panel slide, and we could just take a moment to do that before we finish discussing the question. So, Victor?
Hoskins. Victor Hoskins. I'm President and CEO of Fairfax County Economic Development. Our job is to work with businesses every day. We work with small, medium, and large businesses. There are over 128,000 businesses, establishments in Fairfax County. By the way, that is a huge number, just to let everyone know. And we have a workforce of about 628,000 or so, which are highly educated workers, many of them. My job every day is to make sure the business is in business and getting back to business. I'll talk more later, but probably the most recent thing that you might have heard about is the Microsoft announcement, over 400,000 square feet, 1,500 new jobs, $64 million investment. So that's the kind of thing that I work on every day.
Thank you, Victor. Chip?
My name is Chip Petroc, co-director for the Center for Applied Proteomics and Molecular Medicine at George Mason. As Dean Lewis described, we have a very unique laboratory in the Science Tech campus out in Prince William County. We have a CLIA laboratory component of our center, where we are investigating a number of different types of biomarkers for disease detection, like cancer, Alzheimer's disease, traumatic brain injury, et cetera. And we do a lot of work in the infectious disease side of things as well, in a great ecosystem out here with molecular virologists in the containment research laboratory here, Cell 3 laboratory, as well as our molecular diagnostics. So it's a great ecosystem of scientists and computational biologists, epidemiologists that we work with as a team. What we're doing that's directly related to kind of the reopening process is we're developing a unique saliva-based antibody test. And we think that this is going to be a great opportunity for monitoring in the workplace for prevalence of infection from a policy standpoint, as well as we have a role of assessing the analytical performance of many of these tests, which, as you know, there's been lots of questions about the analytical performance of the virologic tests and the antibody tests that are out there. We have a job to try to help understand the true scientific facts of their test performance and even develop our own testing methods to try to increase the analytical performance of these tests so that people can have full faith in the test results, which can be quite daunting given the need to be highly accurate, both making sure that people who don't have the virus are called negative correctly, and those that do have the virus are called positive correctly. So we are we're hoping to be a great resource to both George Mason University as well as the local Northern Virginia ecosystem and the state ecosystem as well. So we're pleased to be able to basically lend a shoulder into the team effort.
Thank you, Chip. Sean?
Yes, I'm Sean O'Connor. You may be wondering why someone dealing with intellectual properties on this panel, but my real expertise is in the history of innovation as it's helped social, cultural, and material or economic development. And so my perspective relevant to this panel has been about how you reopen a complex economy that accreted or was built up layer by layer over a lot of time. And when you severely disrupt that pearl-like development, then you don't necessarily just flip the switch and put it back on. So I think we're going to have to look a little more carefully at how we do this reopening, but I'll defer to the scientists here as to when it's safe to reopen.
Thank you, Sean. Dan?
Okay, thank you very much. Very pleased to have been invited to be part of this panel. Thank you, Lewis, for the invitation. So I'm Dan Hauser. I teach behavioral economic policy at George Mason. And today what I'm going to do is talk a little bit about the importance of giving everybody voice when we try to balance the benefits and the costs of public policies generally, but especially as they relate to the current crisis. As we begin to open Northern Virginia, we must now confront the difficult question of how rapidly we should advance from one opening phase to the next. And to answer this, we need to hear from everyone regarding not only the benefits, but also the costs of restrictive policies. And unlike easily communicated case counts and hospitalization rates, all of which are very important, the broader public health costs of restrictive policies can sometimes be difficult to convey. A few weeks ago, the department, the economics department, received a poignant note from an outstanding undergraduate in our program, and she's given me permission to share an excerpt from it with you. During the height of the stay-at-home orders, she wrote, "The ongoing COVID-19 restrictions make everyone vulnerable, even those with previously stable personal and financial lives. But you can only imagine what happens to people in my position who are on the margin, even in normal circumstances. It's painful for me to go into details. It has been excruciating." So the message from this student is that a focus on protecting against one risk, in this case, the risk of very serious harm from the virus, that can blind us to the severe risks of not just economic, but also emotional and physical health harm that restrictions can create. Moreover, the risks of harm due to restrictions are often faced by people who, according to emerging data, confront very little risk of harm from the virus. So, look, there are no easy answers. There are no perfect options. But everyone should have voice in creating COVID-19 policy, and no effective or sustainable policy can privilege some risks over others. As our student implores, we must consider the full picture and hear everybody's voice when we decide the question of how to reopen. Thank you.
Thank you, Dan. And Amira?
Thank you, Dean Lewis, for putting this together. I am a professor of global health and epidemiology and served as an epidemic intelligence service officer or an outbreak investigator at the CDC, where I worked on emerging viruses and preparedness and response protocols. I then moved into more tracking diseases, surveillance, and have been leading an international MERS coronavirus study for the last few years, and working on COVID-19, especially to understand disease progression, and I'm collaborating with Chip and other members of his center to validate some tests and also to use them to really understand what immunity looks like. And we're focusing in on healthcare worker populations, as well as some other vulnerable populations. One thing that we're really trying to understand is what are some potential long-term consequences or sequelae from this virus. So recently there's been a lot of reports of multi-system inflammatory disease, and those have been among young adults, teenagers, and children. And we're talking about high school and college age kids. This is just in the last few months. So, those sorts of risks have to be taken into account as we also think about the really serious risks of staying indoors and losing some of your social connectedness, which leads to increases in anxiety and stress, as well as some of the health harms that we're seeing as children miss their well child visits. And we're starting to see some evidence that maybe immunization rates will go down. So those are the sorts of things that I'm working on right now in the space of COVID-19, along with advising businesses and other entities on how to open up safely.
Okay, thank you, panel members. And maybe what we can do is start with that next question. I know, Amira, you began to answer it, and would you mind just quickly summarizing it, and then we can open it to the full panel?
Yeah, sure. So this is, a topic that's very important, especially these days. The key indicators are going to include continuing to monitor hospitalizations, deaths, and cases, as well as the resources that we have in place and that we have readily available. Those include PPE, test kits, and contact tracers. I had highlighted that we are looking to have 1,300 contact tracers in Virginia in the next few weeks. Earlier this week, we were at about 300. And so that sort of highlights the great need in building up our public health response systems that, we've all seen have really been strained by this virus. And, frankly, are often strained on a good day.
I think to follow Amira, she gave some very good key metrics, and I think as a diagnostic-oriented scientist, she hit on many of them. But I would add to those. I think for us on the diagnostic side, the ability to get to about 10,000 or so tests per day helps us to, from a testing standpoint, understand whether or not we're seeing any reemergent spikes or peaks in new, as a result of either not social distancing correctly or continued on good trajectories. That 10,000 a day gives us a nice kind of constant surveying of the Virginia landscape is important. And I'd like to see the positivity rate get down to below 10% or so. This is important, as Amira could probably tell us, from a epidemiologist standpoint, to get into a sense that the viral trend would continue to keep going downward rather than upward in the number of new cases. But of course, the hospitalization and overall mortality rates will be important because until we have better, accurate testing, we know that we are missing a significant number of people who actually have COVID but are determined by the diagnostic test right now to be negative. We know that there's a lot of false negatives out there, both with the antibody tests and the virologic tests. As I said, we're hoping to help change that trajectory by getting better tests, but it's not just testing more, but testing more accurately. But I'd like to see that number about 10,000 a day and the positivity rate, which is trending downward, to get below 10% if we could.
Other perspectives?
Now, the one thing I would, add is we know that asymptomatic transmission is a really important driver of some of the COVID-19 outbreaks. And so it is going to be critical that as we continue to open up the economy and go from one phase to another, having really good testing linked with timely contact tracing and self-quarantining is going to be key to keeping asymptomatic transmission low. And that is going to be a really important activity that we have to make sure is done and done well in order to avoid sort of closing down the economy again.
So, Sean, your analogy to the pearl, the economy developing much like a pearl in layers, I'm wondering if you see different indicators of the various layers of the economy.
Yeah, so as I said at the outset, I'm reluctant to say when we should reopen because I really want to defer to my epidemiology colleagues here. But I guess I would say that just to voice it, maybe to get a little provocative, that there's an end point at which we just don't have any economy left and the government can only print so much money and hand out so much money, which it's not even doing enough of right now. And so then it becomes kind of the bizarre reality of how we get things going again. And what I'm looking at is I don't think people understand the full level of disruption to not even just global supply chains, but even just national supply chains. So far, there's still food in stores and that kind of thing. But I think that we really need to look at if there's going to be a long haul here, and it may, again, we may have a spike next year, how do we restructure and go back and do local supply chains for things like food and other essentials? So in other words, each region may have to become much more self-sufficient because we may not have the kind of magic reopening day. We know it's going to be phased in as it is. And so how do we really get all this going again?
I'm checking in with the panel to see if they have any other comments they'd like to make. And if not, we could try the second one or hear from Michelle if there are questions from the audience that would be appropriate to bring in at this stage.
So, Dean, I'd just like to make a quick comment. One, I think it's important to contextualize this. We have 91,000 people that have filed for unemployment claims since mid-March. So just the scale of the number is dramatic. The interesting thing is we've never been in this position before in this county. I don't think we've ever been in this before in this region, where unemployment went from 2% to 14.5% in 2.5 months. It is just the speed with which it happened. I think Sean's analogy was profound, that you build it up over 11 years, from the high unemployment rate to a low one, and then all of a sudden you drop off a cliff. I think that's really what is really going to make this complicated, this reentry. I'm so glad that we'll be reopening tomorrow as the beginning first phase. But if we reopen, the key is focusing on the areas that were impacted the most, because some industries have been hardly impacted at all. And that we don't have to go into those. Those are the technology, those are the distance workers, those are the ones that shift to the cloud quickly and can do their work at a distance. The people that have to face-to-face, hospitality, retail, restaurants, these are the workers that really were impacted the most by this. And in addition to them being impacted directly, their incomes were already low. So you had this disproportionate impact on lower income workers, which is one of the things that made it this very, very difficult. The key is, how do you get back in? I love the fact that Maryland, DC, and Virginia all decided to coordinate on opening day. That is a profound thing. Sean knows this. I'm a practitioner. I am not a theoretician. I don't deal with theories. I deal with actual facts. And the fact is, that is profound. And it's important for a number of reasons. One, just the relationships between the institutions and how they interact with each other. Also, it's a consistency for people who have multiple locations. Many of these restaurants, hotels, they all have multiple locations. And if there were restaurants opening, 3 months from now, in DC, and 2 months from now in Maryland, and now this month in Virginia, that would have been a problem. But all opening, and then this 50%, and outside, everything. These are all things that people right now feel comfortable with. We all have heard enough to know that outside is better than inside. That a face covering is in a face-to-face conversation is better than no face covering. There's some basics that people have acquired, and it becoming, in a way, almost accepted as social norms. And they're beginning to be viewed as positive, like me wearing a mask protects you, you wearing a mask protects me. And I know I'm talking about the social interactions, but this is the office environment, this is the retail environment, this is the restaurant environment, this is the social environment. So if we're going to get back together, we have to have some norms really introduced into our society that haven't been here. And I've seen these norms in Asia since the late 80s when I first went to Japan. So I've seen these in other cultures. They're new to us, and they're difficult for some people to accept, and they're complicated. So I think that's one thing to realize. But getting back into business is going to be, it's going to be like we all got used to the TSA at the airport. After 9/11, I had friends tell me, I'm never going to fly again. I'm not getting on another plane. We had more people flying after 9/11, actually pre-COVID, than ever before in history. Oh, here's another one. No, tall buildings are going to be built. More tall buildings have been built in history since 9/11. But see, the thing is, this is emotional, and there's this social, and these new norms that have to come into place in order for business to operate and for all of us to operate. And frankly, I mean, everyone knows about TSA pre-check and global entry, and I think these kinds of things in our airports, in our hotels, in our restaurants, they're going to become norms that we get used to and not afraid of, because we have to lower our fears in order to get back to a social interaction level that is economically viable, because some of these restaurants can't operate at 50% capacity. I love the fact that they have said all over this region, we will block off streets, we will take parking spaces so that you can have outdoor dining. See, to me, that is a profound thing. We have special hours for people 60 years of age and older to shop for groceries. To me, these are the things that need to be introduced into the business environment where business people go, hey, that looks like, that works for me. And those are the things will get us back open. I'm not going to go any further because I got a million things I want to talk about, but I think just as an introduction, having the context, understanding this perspective to other, situations that have happened before, these social norms as they relate to business opening, I think these are the things that are really important for us to think about right now. And actually, we're going to see in practice tomorrow.
Yeah, those, if I can just follow up real quick, I think those are just terrific points. Very well said. And just on the social norm question, very briefly, another statistic we might want to track is something about compliance with these new social norms that we're trying to establish. The Swedes have been, as we all know, they followed a different strategy regarding the virus, and they have a very different set of policies that provide people a lot more ability to get out and sort of more or less engage in life as usual, even in the presence of the virus. How can they do that? Well, one thing people point to is that there's a lot of conformity to the norms of healthy behavior in Sweden. And that has helped them, that trust in the conformity to these healthy social norms in the presence of the virus has helped them to stay more or less open during this crisis. So I think that's a great point about social norms, the importance of people adopting to the new norms for social health and learning how we can promote those norms, track compliance. That might be a big step forward, being able to reopen more quickly as opposed to less quickly.
Okay, well, that's a great segue into the question of what are the big concerns about tomorrow that panelists might have?
Well, I don't know so much about tomorrow as a specific date, but tomorrow kind of in the philosophical sense, what are my concerns about, going forward tomorrow and onward are, and I think you touched on some of these in your opening remarks, Dean Lewis, and that is, I'm concerned about the fact that we have, women with metastatic breast cancer not getting into the trials that they should because they're too afraid of having to travel to a trial site and staying in a hotel room, maybe in a distant city. I'm afraid of patients with, blood in their stools not getting the colonoscopies that they need, that are going to arise as stage 4 colorectal cancers the next year. So my hope is that as a metrics in some ways, that we will see a reemergence of people getting their health and wellness taken care of. We can't be so scared of COVID to put off the other big things that could harm us as well, especially those that we have proper surveillance and chemopreventative and diet preventative ways of taking care of from an early detection standpoint. Let's not provide the COVID situation for increasing mortality in an unintended way by ignoring some of these other diseases that don't quarantine and will not go away no matter what. So my worry is that folks won't go back and take care of themselves. And I'm not even touching on the huge aspects of the mental aspects of the anxiety and depression rates. They're exploding throughout the United States and the world, perhaps.
My worry for tomorrow, as the date that lots of areas in Northern Virginia, DC, Maryland are going to enter phase one, is that people are going to enter too quickly, because we have to remember that this is a gradual reopening. Phase one, as some political leaders are referring to, is somewhat of a stay-at-home light, right? We're still talking about gatherings of 10 or fewer. We're still really trying to minimize the amount of time that people are within 6 feet or less from each other. We're still encouraging people to wear masks and to take precautions. And so this is going to be really important, because we want to maintain a somewhat flat curve. We want to spend the next, few weeks re-entering the economy as safely as possible, so that those individuals that Chip mentioned can go and seek healthcare safely, and so that the hospitals aren't inundated with people trying to catch up with their well checks and a surge in COVID cases. So that's what I find myself thinking about, that I hope people do understand that phase one opening is a somewhat of a soft reopening, right?
Yeah, I'd like to follow up on Amira's point. A lot of what I'm trying to get at is that we don't flip the switch and everything comes back on immediately. And why I keep saying it that way is I think there's a lot of hope that starting tomorrow or in the next week or so, we can kind of get back to full employment or something close to full employment. And if the reopening in phases happens the way it's supposed to, then that's not what happens. Instead, lots of people are still out of work. And again, how much money can we keep sending to them? We can keep, the government can print money. And so if we don't do that, then what really is the solution for how we get people back to work and we get things happening? And I'll just use a more particular example. In Italy, there's been news stories that a lot of people have gone back to work on farms, which may not be appealing to a lot of us, but that's kind of what I'm getting at with the Pearl thing. It's not even just, as was mentioned before, that, it was 11 years since the last recession. I'm talking about, more like over 100-year kind of span, 200 years, where we've built up economies from very local agrarian-based economies. Things were made, clothes were made locally, food was made and produced and consumed locally. And then we managed to layer up to more regional and then national, and then be able to have, refrigerated ship containers and all that kind of great stuff. That's really what I mean by layered up. And so I think we really have to get serious about that. As we look at this, we may have to go back to figuring out how we're locally sustainable before we can really, and that's the only way to get people back to work on anything on the scale we need, while we still do social distancing and all that.
Okay, thank you. I'm getting notification that we have several questions from the audience. And so Michelle will be posing those questions for the panel. So if you have other comments, you might be able to work them into the responses to the audience's questions. Michelle?
We have several questions around infrastructure and scaling infrastructure. One specific question around contact tracing and the ability to reach that target number that Fairfax County has of 1,300 tracers. How are they building that cadre of tracers, and are they primarily relying on nonprofits to do that?
There are quite a few organizations that are working on identifying individuals who can get trained to become contact tracers. The local health departments throughout this area, this region, are advertising and college students, graduate students are applying for these jobs, and the workforce, the contact tracing workforce is slowly being built up. So I can see that, in a few weeks' time, we will meet the demand for contact tracers.
There are also similar questions around the antibody testing and the ability to make that widely available if that truly is a way to help gauge safety. Dr. Petroc, that is a question for you.
Well, first, let's be clear that we do not know yet, as you've likely heard, whether or not being antibody positive confers long-lasting protective immunity. I think there was a little bit of initial thoughts about you could give these, immunity certificates and things like that. I think that's calmed down a little bit because we don't know right now how long immunity will last. We certainly feel like you will be immune for a period of time. We just don't know how long that is or what the relationship is of how much antibody you have to have with being immune. There certainly is really no evidence right now that has emerged where someone that has truly been infected and is truly recovered can get infected again. There's been no real case reports of that yet. And so when we look at other viruses, and Amira can tell us this from SARS and MERS, being able to recover from these coronaviruses usually does confer some level of immunity. We just don't know how long. So we have to be careful of, using antibody testing to somehow stratify the population into I don't have to worry at all to, I still have to worry. I think it can be very helpful to know that you have been exposed and infected when you may not have known it, because as Amira said, we have a fairly large, one of the aspects of this virus is a very large asymptomatic population rate that's very different than, say, the flu or other viruses. And so we think, and it's helpful from an epidemiologic standpoint to understand what the real fatality rate is, because we have so many people that don't know that they're infected. So I think the antibody testing will be an important component, a layer with virologic testing to help to understand what the case prevalence is, and also understand what the workforce prevalence is, who's been exposed, who hasn't. And these tests will become more widely available and more accurate. Science, as I always say, is we always play from behind, especially in a pandemic. Scientifically, we weren't even developing antibody tests for coronavirus 3 or 4 months ago, and now the FDA is helping to filter, very accurate tests out. Only 90 to 120 days later is actually quite dramatic in the diagnostic community to get these tests out. So I would say to the audience, the test accuracy is going to be getting better. You have lots of scientists working on this to get the test accuracy up. We're not there yet. And even once we have very, very accurate tests from the antibody side, it doesn't mean that you can just be completely confident that you're immune for the next year. And so we'll be coming out, science will be coming out with more data every day, every week that can help inform policy. But we're all getting, the science is going to be hopefully providing the community better and better tools, and the government and the policymakers better and better tools to understand where we're at.
And the one thing I would add to what Chip said is we are learning a lot from our international partners who are, in a way, ahead of us in their response to this coronavirus. And unfortunately, in the U.S., our markets were flooded with some pretty poor quality sero or antibody tests. And the media right now has kind of caught up with what's been going on in the last 2 months, and that message is out. And I think it's going to stay around for a while, that antibody tests aren't good enough. And the fact is, we are in the midst of creating better and better antibody assays, and they're going to start rolling out in large quantities. And so as we're reopening and we're looking at antibody testing strategies, we are going to have better tools available. And we also have some great examples to learn from some of our partners in Western Europe, especially.
And I want to move a slightly different direction from that, because a private question had come in to me from someone asking about tests, if they're developed with government funding, are they not commercially exploitable? And then will the test be expensive, maybe not insurance covered? So that's actually a thing that I can address. Here's basically the deal. So when the government funds research and then things that can become patented and then commercialized, things like tests, if there's government funding involved, there's a federal law called Bayh-Dole, and that means that the university or the researchers who came up with the invention primarily own title to it. They can exclusively license it out to the market, to a manufacturer, which means that you could then have to pay full retail price. Hopefully insurance covers it if they recognize it as valid, but you're in the regular private market. However, under Bayh-Dole, there's also margin rights, which is a part of the law that says if the contractor, the university or the private sector player who got the exclusive rights, if they fail to bring those things to market, then the government can license to someone else to essentially put those tests into the marketplace. But again, it could be at full retail price and not particularly cheap. However, there's also another part of the law that gives the government a license to use the invention for government purposes. And so if the federal government decides it wants to make these tests available at low or no cost, it can do it. It can use a private manufacturer. Now, it'll have to pay that private manufacturer, so still not free, but it could be free to the end users. That option is not available to states because states are not the ones doing the doing the funding of the research necessarily, and they also don't have a kind of Bayh-Dole law. So if your state wants to produce, make the tests available to the public, then it's either going to have to buy them on the private market and then decide to just absorb that cost. Or, and this is much more controversial, but it's been in IP law now a big deal for the past few years, it could rely on the doctrine of sovereign immunity under the Constitution, which means that that states can't really be sued in federal courts. I don't want to go all the way into the weeds about it, but it's controversial because it means that sometimes states can kind of go ahead and infringe private patents and copyrights and things without having to pay up for it. So that's the more controversial part. But right now it seems like states want to do provision of testing. So they're either going to rely on sovereign immunity to do it, for free, so to speak, or they're going to have to pay private market people to do it, or the federal government can do it under the government license. I hope that made sense.
We have a number of questions directly related to Mason, starting with, is this the panel that's making the decision on Mason's decision to reopen? And questions, very granular questions around withdrawal policies and dormitory policies. Jermaine, did you want to comment on that?
Yes, I probably can. So not exactly, although some members of the panel, to my knowledge, have been working with the university leadership on a whole array of various working groups and teams trying to, in their areas of expertise, whether it's testing or contact tracing or securing facilities, protecting dorms. There are a whole host of individuals that are working on that for the university. And that information is being made available to leadership for a final decision in terms of what the university is going to be doing for fall 2020. As you may know, all of our instruction, all of our courses are online all summer, all 3 summer sessions, but the decision about fall isn't there. I don't know, I think there are something like 12 plus working groups, and so maybe some of the panel members are involved in some of the working groups. I know I'm involved in one focusing on contact tracing because the university will be doing its contact tracing should we resume in the fall. So we're preparing for that, but I'll let other faculty members disclose if they're working with the university in some capacity. Anyone?
Well, our lab is certainly trying to help on the serologic and virologic testing side to provide some infrastructure for the university, but also to be an impartial tester, if you will, of the different kinds of tests that are out there to evaluate them for their robustness without clinical or commercial prejudice, so that we can advise the leadership on at least what tests and what tools seem to have the best performance, which would be an important aspect of leadership's decision making. So we're certainly involved in that side.
And in addition to what Chip mentioned, we're also involved in coming up with ways to rapidly identify individuals with symptoms and symptom tracking. And that sort of information and planning is being sent up to their leadership to help them in their decisions.
So the the decision on how to move forward in the fall semester and beyond will be made by the Board of Visitors. And the Board of Visitors is actively seeking input, thoughts, advice from really everybody. Faculty, students, staff, everybody is invited to participate in this decision. It's a wonderful, wonderful example of shared governance. And so, but it's ultimately the Board of Visitors who will make this call. And the date is still unclear. Hopefully by mid-June we'll know a little bit more.
We also have a variety of questions around, is this the right time, given the metrics that we're seeing, the variety of metrics, is this the right time for Northern Virginia to be reopening? Maybe, Victor, you can take a first pass at that, and then Amira.
You know, the epidemiological aspect of this makes it complicated for a business person to answer the question. But from my perspective and the businesses that I'm working with, I think it depends on the industry, and it depends on how they open. I mean, I'll just give you a quick example: restaurants. I think most people right now will feel generally comfortable in an outside environment in a restaurant. I don't think they want a real cozy table huddled up next to someone else who is coughing and warm and uncomfortable in a closed space for a few hours. That might have been very acceptable 3 months ago, not acceptable right now. So that means that I think that it is probably a good time for restaurants to open up as long as they have enough outdoor dining and wear protective gear. I mean, I think that's the kind of scenario you go through. For example, my office, we have an office environment. We are co-located with a series of other organizations that we help support, and we have set up a system right now that is going to really help us transition back into the office. One principle is social distancing. I don't think you should go into an office environment without social distancing. It's been proven to work. Why would you go against it? It just doesn't make sense. So following social distancing norms right now, we can get about 50% of our people back into the office. Well, that's okay right now because we have 100% not there. So I think these are office workers, and I'm going by industry. I think this is what you're going to see. You're going to see different timing for different industries depending on what they provide for their customer or what they provide for their user. Because office building owners are wondering, do we have to take temperature of everyone that comes in a building? Most of them are saying, no, we don't want to do that. But we will allow somebody to put a touchless monitor in front of their door if they want to test everyone that's going into their office. Very different way of dealing with a situation. Elevators. By the way, most of these elevators, particularly in tall buildings, you're going to have to figure out a schedule for people to come to work because you can only put 3-4 people on an elevator now with the appropriate social distancing from health reasons. So all of a sudden you're in a time series. We're already talking about 3 shifts for our workers: 7:30, 8:30, 9:30, leaving at 4:30, 5:30, 6:30. So I think that it's going to be it's really a question of what the business does how the business deals with its clients and its staff, its team, and 3, is it done in alignment with what the epidemiologist has told us are the good things to do to keep ourselves safe? So I don't think there's no fast or slow. I think that it's going to depend on what the business is, what they do.
And some of the key indicators that jurisdictions have to meet in order to move forward and have a phase 1 opening include things like number of hospitalizations and number of deaths and what the number of new cases looks like over a certain time period. And so in this area, many areas have met that, and that's why they're moving into phase 1 opening. But again, we have to remember that phase 1 is really stay-at-home light, right? It's not a full entry into business as usual. And so these are the things to keep in mind. Phase 1 is meant to keep that curve flat and to allow us to increase our economic activity while allowing hospitals to have the capacity to handle COVID-19 cases and to start to see other conditions.
We have several more questions that unfortunately we won't be able to get to. I will ask one last question that will certainly take us past 1 o'clock about long-term education and planning and what we see as long-term changes to how we plan for epidemics. Can we start with Dr. Chip on that?
Well, I think that there's some very good ways, both at the university and societally, to, from a scientific standpoint, a diagnostic standpoint, to come to grips with the fact that we'll be living with COVID for quite a while. And it's important for people to realize, even in a post-vaccine world, we were likely going to be living with COVID like we live with other viruses in our lives through our human evolution, that this is likely going to be around like measles is and other infectious diseases. So I say that as a preamble, that there's really great ways to be able to monitor for the presence of an infectious disease like this going forward. Once we have the appropriate diagnostic testing technologies that have robust characteristics to them, we can get into what's called household or population type pooling approaches. These are especially worked well for the military when they were looking for things like syphilis. The Gates Foundation does this a lot in looking in low-income and moderate-income populations for their infectious disease monitoring. It's a way to pool samples together. You can do this in dormitories. You can do this in households. You could even potentially do this in companies where you can rapidly and efficiently look for the presence of an infectious disease by this type of approach. And we will get there as we develop approaches to do this economically and efficiently. And so I'm somewhat sanguine about these approaches going forward. I don't know what they look like, but we know that we can do them, and we're working towards those types of approaches now.
Is there anyone else on the panel that would like to weigh in on that question, the long-term planning or implications?
Sorry. Please go ahead.
Yeah, I would just add in that we need to keep taking a careful look at the bedside pathway, from everything from basic science research that gives us our insights into how diseases progress, and then into the translational phase where we think about how to then develop, whether it's testing, diagnostic things, or treatments, and then get those in the commercialization stage. We have a private market-based health system, which people can debate about whether that's the right thing or not. But the critical obstacle, I guess I don't really want to call it an obstacle, but the FDA clinical review thing, we're seeing now, and I think Amir was mentioning that when you don't have the FDA involved and you're rushing things into market that haven't been fully tested, they could be scams. But at the same time, people are tempted to do that because they view the FDA as a roadblock. Oh, it takes so long to get these things approved. Well, it takes a while to get them approved because you want to know whether they're safe and efficacious. So can you speed that up more? Well, here's the other issue is that the private companies that put diagnostic tests or therapeutics into the market, they have to pay the full cost of doing all those clinical trials, which is quite a lot of money. So then that forces them on the back end to have to charge quite a bit. So we really need to, if we want to get smart about this, we really need to look at that whole pathway and how we figure out perhaps better ways to get things through it, again, with making sure we're testing everything appropriately, but not having to load in so much costs so that things have to cost so much at the back end.
I absolutely agree with everything that Sean just said. And I'll also say that any long-term strategy absolutely has to take into account the populations at all ends of the socioeconomic spectrum, because we cannot keep having these massive disparities in infection rates, severity, mortality. So long-term planning is going to have to be much more inclusive and comprehensive than, frankly, most of what we've been able to do thus far.
Yeah, those are really great points. Just to reflect those points, it really is about long-term finding ways to live with this virus, and not just to live, but to thrive. And we're going to have to be creative. We're going to have to use all sorts of brilliant people from all sorts of different places and just be the best of all the people we are to find approaches to being able to live fulfilling lives that allow us to thrive even in the presence of the COVID-19.
Jermaine, do you have any additional closing thoughts for us before we wrap up with some housekeeping items?
Well, what I think I've heard, and I think these were included in some of the opening remarks, this is really a very daunting and complicated process to think about how to go about reopening, and it really requires input in the lens of many different sectors to think about how to do it safely. I think I've also heard that a one-size-fits-all approach probably won't work. The slide that's showing now is just illustrating the phases that Virginia has set out to reopen. A couple of the speakers were talking about social distancing and how important that will be as we move forward. The importance of still staying at home or at home light, I think as Mira was calling it. But at least we have a plan. The plan will be starting tomorrow for those of us in Northern Virginia, and we will be joining a host of other communities who are going to be watching, hopefully, the success of the rollout so that we can work in support of health for all. So I'd like to really thank the speakers for engaging in this session, and for our audience for sending in good questions and listening. And I think Dan was the one who said it. We need to work together to make this happen and to do it right on the first try. So thank you all.
Thank you, Dean.
Yeah, thanks for having us. Thanks for organizing.
Thank you.
Thanks very much, everybody.
And thank you to all our attendees. We will be sharing the recording and the slides from this session afterwards. And there was a question about additional resources on how to safely return to business. So we can be sharing more of those in the future as well. Thank you, everyone.
Thank you.